Let's just wait a few more minutes and hopefully more people will come. Like yesterday will begin at 2:05. All right, let's begin. So I will share my screen. Hold on. Technical difficulties. Okay, great. Now let's go. So, you guys were supposed to take a group photo on Monday, but I don't think our other instructor took one, so we're gonna take one now. So could everyone turn on their cameras, please? It's just for the photo. Only take a second. Usher, could you please turn on your camera?
1 second.
Okay. Okay, are you ready? Okay, 1, 2, 3. Okay, great. Let me just put it in the folder. Okay. All right, moving on. So today we'll be looking at epidemiology, and then we'll look at how to read scientific papers, and then we'll learn about environmental health, and then we'll finish with an activity to practice reading papers. Okay, so review of yesterday. What does standard deviation measure? What's the difference between a bar graph and a histogram? And when cleaning data, what should you do with the duplicates? And this is specifically about the duplicates of, like, if you have a person, like all of their data is duplicated. So can anyone answer these questions? Either type it in the chat or say it out loud. Anyone? Any ideas? Okay, Eli, how about you? Can you try one of the questions?
For the first one, it's the average offset from the mean.
Yeah, like the average distance each data point is from the mean. Okay. For number two, how about the news?
A bar graph. Wait. I actually don't know this.
It's okay. Do you
I
want to take a guess?
Okay. A bar graph displays. I don't know. I have no idea. I don't
Okay,
know what to say, even if I want to guess.
that's all right. Thank you for
Yeah.
trying though. Um, Ashrith, do you want to try?
The bar graph one?
Yeah, number two.
Yeah, I think the bar graph is when you just show different things, you compare different things, and the histogram is like single thing. It's just a bar graph, but bars are attached to each other.
Yeah, that's a good way of putting it. So a histogram, it's all continuous, so it's like one range and you split it up in different sections, and a bar graph is distinct categories that do not have to be in any order. Okay, and then number 3. Nidulan, do you want to try that one?
Um, um, I kind of forgot.
That's okay. How about this? I'll ask if you have duplicates of, let's say, all the data of one person, should you delete it or not delete it?
Delete it.
Yeah, that's right. You should delete it because you're not supposed to have duplicates, and that's a mistake. Okay, now we're going to get into epidemiology. This is the credit slide again. So, epidemiology. So, epidemiology is a study of how diseases affect the health and illness of populations. If you break down the word, the origins are in Greek, and epi means upon, demos means people, and logos means study. So it's like a study upon people. And specifically, it's the investigation of the distribution, so who, when, and where, and determinants, causes, and risk factors of health-related states and events, not just diseases, in specified populations. And epidemiology is used to control health problems in communities. So why should we care about epidemiology? Well, it helps us identify risk factors and sources of diseases so we can develop preventative strategies. And these will help us prevent problems from happening before they become really bad. Epidemiological data also shapes public health policies. For example, vaccination guidelines, sanitation standards, and these can also prevent big problems from happening. Helps with identification of health inequalities among different populations. So then people can go and address these inequalities, and it has saved and improved many lives through policies and programs that come from epidemiological data. So the data that they collect, you can analyze it and draw results like we looked at yesterday with the biostatistics. What does epidemiology study? Studies the distribution, which is how health events are spread among a population. So, for example, it could look at maybe what types of people are more susceptible to a type of disease. It looks at the frequency, which is the number of health events in a population, and the determinants, factors that influence spread of disease. So, for example, close proximity, like if you have a lot of people living in one area, that could be a factor that increases the spread of disease, especially diseases that are contagious. And then when you're looking at disease patterns, some details you should look at is the time. So when do these events occur? Place, where do they occur? And people, who is affected? So risk factors are factors that make a person or a group of people more likely to get a disease. So can anyone identify at least one risk factor that's in this passage? I'll give you a few minutes to read it over. There are 3 of them. Does the question make sense to everyone? Or does anyone have any questions about it? Yeah, that's right, Kevo. Children do have a higher risk of death. That's one of them. And then there are two more. Okay, I'll underline. Oh, okay. Well, I accidentally showed that. So, there's the answers. The three risk factors are, the first one is women, because it says women as caregivers may be at higher risk of being exposed to EBOV. That is the disease we're talking about. The next one is ages 35 to 44. And it says the incidence of EVD increases almost linearly with age to a peak at 35 to 44 years old. And then the final one, which Kevil saw, is children. So it says children have a higher risk of death than older populations, with children of under 5 years of age at the highest risk. So there's the risk factors that are identified in this passage. Okay, next, some terminology related to measures. Incidence is the number of new cases of a disease in a specified period. Prevalence is the proportion of a population who have a specific characteristic in a given time period. Mortality rate is the proportion of a population who die at a defined cause. So, like, because of a certain disease. And then morbidity rate is the rate at which an illness or a disease occurs within a population. And then there are two main branches of epidemiology, that is descriptive and analytical. Description is about the distribution of diseases within a population, and it answers the questions of who, what, when, and where. And then you have the other branch, which is analytical, and that one looks at the causes and associations of diseases. It answers the questions of how and why. So descriptive is more about like the facts, like what is happening, where is it happening, who is it happening to, and when is it happening, and then analytical is more about, it's still about the facts, but it's about like the causes and the reasons why. So it would answer the questions how and why. It's like the processes and then the causes and reasons. Okay. Let's watch a short video about epidemiology.
Guess which student has a better chance of getting into an Ivy League school? First, take a look at Zach. He's valedictorian.
Epidemiology, the backbone of public health, not to be confused with the actual backbone, which is often done by dodgy chiropractors. So if you are studying epidemiology, maybe as part.
Wait, can you guys hear it? Can you give me a thumbs up if you can hear the video? Okay.
An MPH program, and you're finding it more confusing than the latest season of Game of Thrones, I don't blame you. When I first started studying epidemiology, I actually thought that I'd walked into a foreign language class. In fact, if you're not a little confused, then you're probably not paying attention. Epidemiology often seems like a complex conglomerate of seemingly unconnected ideas. Again, very similar to the latest season of Game of Thrones. Things like study design, confounding, risk, standardization, life expectancy, attack rates, latency period, telepathy. Okay, not telepathy. I was just trying to make sure that you're paying attention. What I'm going to do is I'm going to try and simplify epidemiology, boil it down to a one-sentence definition that's going to give you some context. It'll be like a canvas onto which you can hang these various ideas so that when you take a step back and look at the big picture, you know exactly how these things fit together. Welcome back to this Global Health YouTube channel. My name is Greg Martin. If this is your first time here, please consider subscribing. I'd love to have you as part of this community of like-minded people who want to make the world a better, safer, healthier place. Now, let me start by saying this. If you're working or you want to work in public health, then you absolutely have to have at least a basic understanding of epidemiology. So epidemiology really revolves around trying to measure two things, distribution and causation. And we're going to take a closer look at each of these in just a moment. But first, a big thank you to the University of Maryland Graduate School for their support. The University of Maryland Graduate School offer a fantastic online global health certificate which if you want to study further can be applied to an online master's degree in health sciences. So if you're wanting to study global health, but you can't take the time off work to attend a full-time course, then this is a really good option for you. Click on the link in the description below to find out more. Now, let's talk about epidemiology. We're going to start off by talking about this idea of distribution. We're interested in how various diseases or other states of health, we could be looking at a health improvement, for example, how these things are distributed in society. So if, for example, we're interested in the distribution of HIV, let's take a look at what that means.
This distribution thing is kind of like the descriptive branch of epidemiology. And then the other one is like the causation is like the analytical part.
Well, we're interested in who has HIV, where physically they are, and how that might be changing over time. In other words, we're interested in the demographic, the geographic, and the temporal distribution of HIV in society. Demographic, so these people old people, young people, rich people, poor people, males, females, people who do and people who do not understand all the references I'm making to Game of Thrones. So we're really interested in this broader definition of social demography, any parameter that'll help us understand the different sections of society. Geographic, well, that's pretty self-explanatory. It's where physically these diseases or various states of health might be. And temporal, and here we're interested in how the incidence and prevalence of a disease is changing over time. So firstly, we're interested in the distribution of diseases and other states of health, and we call these outcomes. But we're also interested in the distribution of exposures. And these are anything that may cause or prevent disease in the community. Now, exposures could be environmental hazards, things like severe weather events, meteorological events like an earthquake, or water and air pollution, or exposure to chemical, radiological, or infectious disease agents, or exposure to social determinants of health, things like conflict, gender inequity, and poverty. And exposures can be things like public health interventions, like tobacco taxation, or the provision of medicines or vaccines to treat or prevent diseases. And of course, these kinds of exposures improve health. And again, in this group, we've got the social determinants of health, things like education, employment, the protection of human rights. All of these things translate into an improvement of health at an individual and population level. And this brings us very neatly to the second issue that occupies the minds of epidemiologists, and that is the issue of causation. And here we're thinking about the extent to which these exposures really do or do not genuinely translate into changes in outcomes or the health status of people and populations. So let's talk about causation for just a minute because it's really important. When we see a correlation between two things, as one thing goes up, another thing goes up as well, we often incorrectly make the assumption that there's a causative relationship between these two variables. Now, that's really bad science, and believe me, this happens a lot. So, for example, does eating ice cream increase your chances of being attacked by a shark? Of course, there's a strong correlation between ice cream eating and shark attacks, because, of course, both of these things happen to happen on hot days in summer. But eating ice cream, of course, doesn't cause shark attacks. There's a confounding variable, which is an alternative explanation associated with both the exposure and the outcome. And in this case, it's hot weather. Now, don't ask me about people who swim in the sea and eat ice cream at the same time. That's just showing off. And you're offering the shark both a meal and dessert at the same time. You're asking for trouble. And there's quite a few other things that you need to think about when you see a correlation between two variables before you make the assumption that there's a causative relationship. And these include things like confounding that we just talked about, but also bias, error, chance, reverse causation, p-hacking, and fraud, amongst others. And you can take a look at the Bradford-Hill criteria, which incidentally, even according to Hill, should not be used as a checklist. But I'm not going to get into that in this video. I'm going to create other videos, and I have, in fact, created other videos that look at many of these things. Take a look at them if you're interested. But for now, what I want you to take away is a nice, neat definition of epidemiology. So epidemiology is the science that considers the demographic, the geographic, and the temporal distribution of exposures and outcomes and the causative relationship between them. My channel has got a playlist that deals just with epidemiology if you're interested, so check that out if you want to watch more. Thanks so much to all of those that support this channel at patreon.com. I really appreciate it. Couldn't do it without you. And of course, a big thank you to the University of Maryland for their support. Click on the link in the description below to find out more about their programs. Thanks for watching. Take care.
Okay, let's look at that chart one more time. So I think it's a really good chart. So shows you the two branches, the descriptive and then the analytical one. And then exposures and outcomes are pretty important in public health. So exposures is like what a person like is exposed to, for lack of a better word. So some examples he gave was like weather events, viruses, laws, medicines. But can you guys think of any more? There's a lot of different exposures that could be possible. You can type in the chat or say it out loud. You can take a guess as well. It's okay if you're not right. So think about what's something a human could be exposed to. Something that could lead to some kind of an outcome. I'll give an example. One example could be like, oh, let's see, poison? Yeah, definitely. You could look at poison, maybe if you are exposed to poison or you're not exposed to poison, or you can look at different types of poison or how much poison. Another example is like sunlight. People who are in the sun for, maybe you measure how many hours people are in the sun for. Or another example could be like education, something like that. Okay, let's go back to the slides. So exposures, we just talked about this. This is anything that an individual or a population comes in contact with that can influence the development of a disease or their health. So some other examples are their diet, so like the different things they eat, maybe what they don't eat, air quality, like what's in the air, how good the air is, access to healthcare. So be like if they have insurance, if they like live really far away from a healthcare facility, then stress levels. And then another important definition is intervention. These are actions and strategies to combat disease and health conditions in a population. Interventions strive to change exposures and improve health outcomes. So basically, this is anything that is done to improve health or change exposures. So some examples could be a vaccination program, regulations. This would be like sanitary regulations, regulations for, let's say, factory workers, stuff they have to follow to make sure they're safe and healthy, and air pollution control. Okay. And then, I don't know if you guys know this, but there's a lot of different types of studies. You know, we study like what happens, for example, if two people take one kind of medicine and see what happens, which medicine is better. If one medicine works, maybe the other one doesn't. But there's a lot of different types of studies you can do. Studies are just like experiments that scientists do to figure out some kind of health problem or a scientific problem. And this is one way you can categorize all the different studies. There are definitely other ways to categorize and sort studies, but this is just one way. So first you split it into observation or non-experimental, and then experimental or interventional. So observational or non-experimental, that is, you're just observing what happens. You're not doing anything to people. You're just seeing what happens, people in their like natural state. And then you make observations, take the data. Within these, there is individual-based and population-based. So population-based, you look at populations as a whole, not individual people. So this could be like a descriptive study, like health survey, or it could be an analytical study, like an ecological study. So that looks like that takes data from populations, let's say like the air pollution levels of a city, or like how many cases of some kind of disease at um like in a whole state or something. So these are based in populations. And then you have individual based, which is based around individual people. So you'll have data from individual people. While in ecological studies, it's like a lot more broad. And you have data from like a large group, not individuals per se. Yeah. So something like that. Individuals, you have descriptive study, case report. And then you have three types of analytical studies. So you have a cross-sectional study. This one is like you take the data of a bunch of people at one point in time. It's kind of like if you cut a cross-sectional, you just see the data as it is right now. So you could measure something like maybe you look at a group of people's diet and then like BMI and then what type of diseases they know they have. But it's all at one time point. And then there's also case control studies and cohort studies. And then on the other side of it, you have experimental or interventional. So in these studies, you do an experiment to the people. You not only observe them, but you like implement some kind of change in their lives. So you can see how the change, which is also called intervention, how that affects them. And then in these you have randomized studies and non-randomized. So sometimes you want to like randomize, let's say like who gets the real drug and who gets the placebo, something like that. So in those you have a clinical trial and then non-randomized study. This is like intentional. You know which groups are getting what type of change. And these ones is like a community-based intervention. Okay, does that make sense so far? Yes, okay. Next, let's look at this passage. It's also from a study. It's from a cross-sectional study. So this is the one where you take the data from one point in time. It's like you're cutting a slice out of time and then you're just taking all the data from that one time point. So what type of data from this cross-sectional study can we gather from this passage? Think about what the exposures are and what the results are. You guys can underline on my screen, type it in the chat, or say it out loud. I'll give you a little bit to read it. Anything? Let's just give it a try. It's okay if you're wrong. Okay, can anyone tell me any type of anything you see in this passage that might be some kind of data? on. Okay. Yeah, 74% of Americans get calories have, yeah, 74% of Americans get calories have high BMI. Yep. There is a lot of these. So, for example, American adults who consumed more than 74.2% of their calories as UPF, which I believe is ultra processed foods, had a higher BMI by 1.6 kg per meter squared and a larger waist circumference by 4.1 centimeters, compared to those who consumed less than 36.5% of their calories as UPF. So that's a lot of data. I will put the exposures in orange. So that would be American adults who consumed this much of their calories as UPFs. And also another group is those who consumed less than 36.5% of their calories as UPF. And then we have some results, which I'll put in blue. So one result is that this group of people had a higher BMI of 1.6 kilograms per meter squared and larger waist circumference by 4.1 centimeters. So yeah, those are some good examples of exposures and results or effects. Okay, moving on. Yeah, so these are the answers. UPF consumption and BMI and waist circumference. So those are the exposures and outcomes. So like UPF would be the exposure, and then BMI and waist circumference, I believe those are the results or like the outcomes. Yeah, so those are some examples that are highlighted. Then some applications of epidemiology. You can use it to study the disease trend since the past. So you can look at how diseases spread or how they behaved in the past and apply it to the present or the future. So you can like use the same patterns. Use it for community diagnosis, planning and evaluation of health services. So like if a city were to spend money on a health service, you could plan it well and then evaluate how well it's working. You can determine the risk to an individual and search for the cause of a disease. Yeah. And there's definitely some challenges as well. One of them is ensuring representative data. So making sure that the data you use in a study matches the population accurately. This is really important because when you take data from real people and then you draw conclusions, you want to make sure that you can apply the conclusions to the real world, not just one group of people. Because different people, like different demographics, like male, female, let's say like different races, different ethnicities and ages, they all respond and behave differently in terms of health and medicine. So it's important to have representative data so that the results can be applied to everyone in the whole world. Another challenge is respecting individuals' privacy and consent in balance to the need for data. So, of course, the best way to get any data is to just do any experiment you want, but people would not like that, of course. So you have to respect people's privacy, their consent. They have to agree to the experiments they're doing, so that people aren't harmed. Another challenge is quick identification and response for emerging diseases and new health threats. This is not the easiest thing to do. and then also global health threats, which require a coordinated global response, but cross-continent communication can be difficult. So maybe like they speak different languages, have different time zones, different priorities, and what different countries prioritize. So summary of epidemiology. Epidemiology studies the distribution and determinants of health events by studying disease patterns, such as time, place, and people. There are different ways of measuring epidemiological data, such as incidence, prevalence, mortality rate, and morbidity rate. Descriptive epidemiology studies the who, what, when, and where, and analytical epidemiology studies the why and the how. But in the end, epidemiology helps us find the cause of diseases and helps prevent some disease from spreading further. All right, does anyone have any questions? No? Okay. So here's another video about epidemiology. I think it's a pretty good summary and introduction video.
In 2014,
Okay, so we're just gonna watch this. It's about 15 minutes.
outbreak of the deadly virus Ebola was spreading across Guinea, a country in West Africa. The outbreak had started in a small village, but spread rapidly. By the time health officials were able to end the outbreak over 2 years later, there had been more than 11,000 deaths associated with the virus. The Ebola outbreak is a classic example of an epidemic, when more people in a group than usual develop a particular illness or condition. But epidemics don't need to be an apocalyptic viral event that dominates headlines. For example, as of 2019, over 80% of school-aged children in China, Singapore, and South Korea were nearsighted, which is more people in that group than we would expect to have that condition. So we could say that nearsightedness is an epidemic. But no matter which kind of epidemic we're studying, we need epidemiology to help us do it. Epidemiology is basically where all the sciencey stuff happens in public health. It uses microscopes, data, math, and pi. Don't worry, we'll get to that. Hi, I'm Vanessa Hill, and this is Crash Course Public Health. Epidemiology is the study of the patterns of disease and health conditions within populations. It also studies the patterns' causes and how they can be controlled. Much like democracy and the Mamma Mia film franchise.
Let's look at that definition again. It was a good definition. So epidemiology is the study of patterns of disease and health conditions within populations, and also studies the patterns, causes, and how they can be controlled. So you want to look at the patterns and then study the patterns and then use what you've seen like as the patterns to like manipulate and see how you can control them. Yeah, and their causes.
Studies the patterns, causes, and how they can be controlled. Much like democracy and the Mamma Mia film franchise, we can at least partially give credit for the word epidemiology to the Greeks. It comes from the three Greek words epi, demos, and logos, which mean upon, people, and study. So epidemiology is literally the study of what is upon the people, which is kind of a terrifyingly broad field. Like, what is upon the people could describe anything from climate change to whatever Hank Green is plugging on TikTok today. Be sure to check out the link in his bio. But anyway, to specify, an epidemiologist or someone who studies epidemiology wants to know who gets what diseases, where they get them, and when. Epidemiologists are kind of like detectives in a massive game of Clue, or Cluedo. Except instead of Professor Plum in the ballroom with the candlestick, it's more like a bacterial infection on planet Earth that threatens literally everyone. The word and the actual practice of epidemiology didn't gain traction until the 19th century, when it mostly concerned infectious diseases. These are health conditions caused by organisms like viruses, bacteria, and parasites, which are spread between people or picked up from the environment or animals. But today, we understand epidemiology more broadly. This is partly because we also understand health more broadly. And as we saw in our episodes on the determinants of health, our health is affected by more than just germs. It's also impacted by our neighbourhoods, schools, and society in general. But we also understand epidemiology differently because, at least in high-income countries, causes of death have changed. As advances in medicine and public health have meant fewer deaths from infectious diseases in these places, non-infectious, also known as non-communicable causes of death, have become a bigger area of focus. We know that's pretty unfair for lower income countries. We'll talk about that in episode 9 when we focus on global health. So today, many epidemiologists put more emphasis on studies of non-communicable diseases like cancer, heart disease, and diabetes, environmental factors like air pollution, and even the health impacts of natural disasters. They also examine the determinants of health and the inequities in who gets sick. That's also what we'll be focusing on today. Though over at Crash Course Outbreak Science, we spend plenty of time talking about infectious diseases, including how public health tackles them. We know with any big mystery, it's not enough to know that something happened. We want a motive. So as epidemiologists solving a health...
So it's not just the what, it's also like the how and the why.
In 2014, an infectious diseases, including how public health tackles them. We know with any big mystery, it's not enough to know that something happened. We want a motive. So as epidemiologists solving a health mystery, we want a cause for that health outcome. A health outcome is what happens basically any time our health status changes because of, well, something happening in the world. This could be a good outcome, like having lower cancer risk thanks to air pollution laws, or a bad outcome, like having higher cancer risk thanks to factors like only being able to afford to live in an area close to a chemical plant. Epidemiologists begin with a hypothesis about why a health outcome is spreading or occurring in the first place. Then they conduct a scientific study to evaluate their hypothesis. In general, there are two kinds of epidemiological studies that we'll focus on here: experimental studies and observational studies. In an experimental study, investigators expose participants to some kind of intervention or treatment to see how it affects their health. Then they compare the outcomes to a control group that isn't exposed to the intervention or treatment. Now, it's pretty unethical to expose a group of people to something that could harm their health. So experimental studies tend to introduce positive interventions. This might include something like a new vaccine, as opposed to a negative intervention like a virus. In observational studies, epidemiologists observe a population that is already exposed to a particular treatment or risk factor and compare their health to a non-exposed group. This is how we go about understanding the effects of things we don't want to intentionally expose people to, like viruses. One famous observational study was conducted by a pair of British epidemiologists, Richard Dole and Austin Bradford Hill, no relation to me. In the mid-20th century, it was widely known that lung cancer rates were on the rise, but there wasn't a scientific consensus on why. In 1951, Dole and Bradford Hill began testing a hypothesis for this increase: smoking. The idea that smoking can lead to certain kinds of cancer is pretty common knowledge today. But while some research pointed to an association between smoking and cancer, there wasn't enough evidence to confirm that one event caused the other. In fact, smoking wasn't even formally recognised as a public health issue in the United States at the time. They sent out surveys to almost 60,000 British doctors asking about their smoking status in a study that experts have so ingeniously dubbed the British Doctors Study. And after getting over 40,000 responses, Dahl and Bradford Hill found a strong association between heavy smoking and lung cancer. And repeated follow-up studies of the same doctors over the next 50 years confirmed the originally reported relationship of smoking to several different kinds of cancers, including lung and mouth cancer. Unfortunately, when it comes to identifying the cause of a particular health effect, we don't always have the luxury of 50 years of research and 40,000 British doctors on hand. Epidemiologists often have to work quickly to assess and respond to a health emergency. Regardless of the timeline involved, interpreting data is where epidemiology gets tricky, because data on its own don't tell a story. For data to be useful, they need to be interpreted by people. And data aren't always straightforward. Like, data have shown that there is a near perfect relationship between a population's level of cheese consumption and the number of people in that population who die from getting tangled in their bed sheets. This is a very strange but true example of a cliche that scientists have been muttering in their sleep for centuries. Correlation doesn't imply causation. Or, put another way, just because two things seem related, it doesn't mean that one caused the other. So, while the data appear to say that cheese consumption and bedsheet murder both increase at the same time, we need someone, like an epidemiologist, to examine and interpret the data to tell us whether that actually means anything, or if cheese consumption just happens at a similar rate to a lot of other things. To successfully interpret data, epidemiologists need to rely on several pieces of evidence. Like, while the British doctor study was one of the first population-level studies that linked smoking to lung cancer, this wasn't a new idea at the time. As Dahl and Bradford Hill conducted their studies, they were following in the footsteps of animal-based studies and chemical analyses of tobacco that had been happening as far back as the 1900s. Like a lot of science, their conclusion wasn't the product of two dudes doing a thing. It took decades of collaboration between a bunch of people in different disciplines, each following their own unique path of evidence to the same conclusion. One useful tool epidemiologists use to understand the cause of an observed effect is the Bradford Hill criteria. And yes, that's the same Bradford Hill from the British doctor study. Small world. While we won't get into all of them here, Bradford Hill proposed 9 principles for establishing evidence of a causal relationship between a presumed cause and an observed effect. Like whether the effect happened after the cause or if the effect could be reproduced. Another tool epidemiologists use to better understand the sometimes messy relationship between cause and effect is mathematical models. These models tell epidemiologists which variables are worth paying attention to and which ones aren't. Which brings us, at long last, to pi. The Rothman causal pi is a model that helps epidemiologists explain how individual risk factors contribute to a disease. And like any good pie, a causal pie needs a few different ingredients. Except instead of sugar and rhubarb, this pie is made up of component causes, which probably settles the debate about the worst pie flavour ever. Component causes are basically the different risk factors that work together to produce a certain health effect pie. If we have enough cause slices to form a whole pie, we have a sufficient cause, which means the health condition goes into effect. Let's go to the thought bubble. Let's consider tuberculosis, or TB, a highly infectious disease caused by the bacteria Mycobacterium tuberculosis. Because TB is an airborne pathogen, it's generally spread through a pretty basic human action, breathing. And when you have too many people breathing in the same space and one of them is sick, there's a higher risk for transmission. So we might consider overcrowded homes and communities to be one slice of the causal pie. Similarly, buildings with poor ventilation will be worse at getting rid of airborne bacteria, making poor ventilation another notable component cause. Another component of our pie is having a weakened or compromised immune system. Basically, if our body isn't as good at fighting off disease, it's also more likely to get sick from exposure to the bacteria. Similarly, lack of access to a tuberculosis vaccine means our bodies will be more likely to contract the disease. So that's also a pretty big part of the causal pie. Just like how everyone cuts a pie differently, everyone will have a different combination of component causes that combine to produce a sufficient cause for TB. But one slice that's in every causal tuberculosis pie is exposure to Mycobacterium tuberculosis. This is because TB can't, spontaneously generate in our bodies. It needs a source. This is why exposure to Mycobacterium tuberculosis is a necessary condition of TB. Even if all the other risk factors of the pie are in place, Mycobacterium tuberculosis is needed to activate the disease. Now, while the presence of each individual risk factor increases the likelihood of TB, it doesn't guarantee it. But if we fill up our causal pie with a combination of components that produces a sufficient cause, we get our health outcome, tuberculosis. Thanks, Thought Bubble. Not every disease has an easily identifiable necessary condition like TB does. Like the causal pies for high blood pressure might not necessarily share a slice in common. Instead, enough component causes can combine in different ways to form a sufficient cause. And this enoughness varies from person to person. Now, disease models aren't completely human error proof. They're still invented by people and rely on data collected by people. But the more data we collect and interpret, the better our health models get. And in a big, messy world where the causes of disease are often invisible, where cheese and murderous bedsheets go hand in hand, epidemiology gives us the tools we need to make a little bit more sense of the world and how it impacts our health. We'll continue our examination of this big, messy world next time when we talk about health systems. See you then. Thanks for watching this episode of Crash Course Public Health, which was produced by Complexly in partnership with the American Public Health Association. If you want to learn even more about public health, head over to APHA's YouTube channel to watch That's Public Health, a series created by APHA and Complexly. Crash Course was filmed in the Castle Garrity studio in Indianapolis, Indiana, and made with the help of all of these smart people. If you'd like to help keep Crash Course free for everyone forever, please consider joining our community of supporters on Patreon.
All right, anyways,
In 2014,
so moving on. So sources and then okay, that's the first part. It's been about an hour, so we can take a 10-minute break and then come back. I'll put the timer on my screen. Okay, the 10-minute timer is over, so we're gonna come back. Then go back. So is everyone back yet? Okay, I'm just gonna assume you guys are back. Okay, moving on to part 2 of epidemiology. So these are some words you might have heard of. Endemic versus epidemic versus pandemic. They sound kind of similar, but they have different meanings. So endemic is consistent, expected, and a predictable number of cases. And this is in one region. And for example, this could be the flu. And maybe it happens every single year. So that's why it's consistent and expected, and then you can predict the number since it pretty much happens every year. Next is epidemic, which is more cases than expected, and the number of cases increases. So there's more cases. And this is still in one region, and one example of this is obesity. Then finally, we have the word pandemic, which is like an epidemic, except it's in many regions or it's global. And one example of this is the COVID virus in 2020. Okay. There's this example study, and then we can look at this. I'll put the link to the study in the chat, and then you guys can look over it, and then we can kind of look at the study. So I'll give you a few minutes just to look over the study for now, and then yeah, and then after a few minutes we'll get back together and then we can talk about it. So yeah, it's in the chat. Let me know if you can't access it. Okay, it's been a few minutes, so let's look at the next slides. So the time, place, and people, they're all in this they're all in the section. Can someone find out what they are? You can type in the chat, say it out loud, or underline it. The time and the people should be pretty easy to find. And someone just take a guess. Yep. So 1990 to 2002, that is the time that happened. Yep. And then children aged from 0 to 14 for years. That is the people. Okay, great. Can someone else find the place? Okay, place is a little bit tricky. I'll underline it. It's not really one place, it's like more of a few places. So, these ones, nuclear facility county group, nuclear facility zip code group, and then non-nuclear facility county group. So either they're like near a nuclear facility or they're not near one. So those are the different places. Let's see. Let me get rid of these drawings. Yep, got that. And then distribution, determinants, and frequency. Well, you can see the distribution of, well, this one just shows the different kinds of diseases and like how often these diseases occur in the population. This table and this graph show the same thing, just in different formats. So one is in a table and one's in a bar graph. Okay, so let's answer these questions. What type of study is this? Does anyone want to answer? Okay, well, let's look at the study and then we can decide. So, it looks like it's a cross-sectional because it says that, age-adjusted cancer incidence and mortality rates for children aged from 0 to 14 for years, 1990 to 2002, were calculated for nuclear facility county groups and nuclear facilities zip code groups, respectively, and then compared those for the matched non-nuclear facility county group or non-nuclear facility group. So it looks like they just looked at the data from one point in time. It does not look like they waited a long time. Let's look at the methods section. Yeah, so it looks like they're just looking at one point in time, how many people have cancer, and then where they're living. like close to a nuclear facility or not close to? Okay, great. What is the exposure? Does anyone want to answer that? No. Okay. Well, the exposure is the nuclear exposure. If they're near the nuclear facility or not. Risk factors, we talked about that in that passage, I think. And then descriptive or analytical. Does anyone want to answer? Eli, do you want to answer?
Analytical.
Why do you think it's analytical? Yeah, Eli, do you want to explain why you think that?
Have percentages.
Yeah, there are percentages, but I think I would say this is more descriptive because it's like who, where, and when. I feel like it's like more observing what's happening, and less about like finding out why or how. Let's see. So their objective was to examine the pediatric cancer risk in relation to the proximity of nuclear power plants in Illinois. So I say this is more of descriptive because it's like their likelihood of getting cancer, which is like based on who, where, what, where, and when. They're not really trying to look at like why they might be getting more cancer risk or like how. And then yeah, the why and the how is analytical, so it's not analytical, so it's the other one, which is descriptive. But that was a good guess though. Okay, so here's the sources for that section. And then we're going to look at how to read studies or scientific papers. Oh, should have done this before. But so these slides are adapted from or like taken from the Purdue University slides. They're linked here. Yeah, so just want to give credit to that. And then here's our credit slide. So how should we read a research paper? Oh wait, before we continue, does anyone have questions on epidemiology? No? Okay. So how should we read a research paper? Well, reading a scientific article is a complex task. The worst way to approach this task is to treat it like reading of a textbook, reading from the title to literature cited, digesting every word along the way without any reflection or criticism. So this is a quote from someone well known. I'm not really sure who, but yeah, this is a good summary of how you should read a research paper. So you should not read every single word from beginning to end without thinking about it. So let's talk about how to do it. Got help from Zochu B. Wang, who he helped us. So first let's talk about why you might want to read a research study. Well, there's a lot of reasons. One is it's actual data. It shows real numbers and describes how the data was found. So like the experimental conditions in which it was found. Like this is not just guesswork or predictions. This is real numbers and observations of what happened. Another reason is that it's more up to date than a textbook because these papers are getting published like all the time. you can find papers that are published within the year or like a few years, and that's definitely more recent than textbook, because textbooks can be like 20 years old and you're like 100 years old. But if you have a paper, it's the most recent one, the most recent research, and you can find papers, like you can actively find papers that are from as recent as possible. Okay, and then also if you look at a study, then you can replicate the experiments done in the study. You can use the papers to learn about the experiments, or because the papers write about how they do their experiments in a lot of detail, you can do the experiments yourself so you can find more accurate results. And then finally, it shows the logic behind decisions. So like the paper writers will explain why they did certain things, why they made certain decisions, and what their reasoning is to get from their data to their conclusion. And because they explain their logic and thought process, you can decide if you want to believe it or not. So you don't have to believe it. Like if you feel like it's really sketchy study that doesn't really make sense, then you don't have to believe it. And you're allowed to decide that, and you can decide that because like you know the reasoning and stuff. Okay. So why are these reasons important? Well, it's also important because scientific papers are one of the ways how scientific information is shared and learned. It's one way that scientists can communicate and share their findings after they do an experiment or some kind of research. And then other scientists can learn from the scientists that give the results. They can learn from them by reading the papers and learning the information, the results, the methods, all that. So it's a really good way of communicating. So it's important that you know how to read studies in order to make the most out of your time and learn the most information, but also to, well, if you know how to read it, it can also help you write it, to write an effective paper so that you can communicate well to other scientists. Okay, so how should you not read a study or research paper? You should not read it like a book, so reading every single letter, and you should read it like a dictionary. So that means you only read the parts that are important to you. You don't want to read every single thing front to back because you don't actually need to read all of it. You want to first decide if you want to continue reading the rest of the study before you read the whole thing. So read with intention and read actively. Don't just passively skim all the words. Look at the words and then analyze them. See if what the paper is saying is relevant or important to your research topic. And if it is, then keep reading. Okay, now let's get into some more specifics of the different parts. So there's a general structure. Well, let me go to. So the structure of a study usually looks like this. So you first have the title of the study, and then the author or authors, usually more than one. And then they'll all start with an abstract, which is a brief overview or like a summary of the study. And then this section is just to help you decide whether you want to read the rest of the study or not. So if it seems like the information could be relevant to you, then you'll want to read the rest of it. But if it's completely unrelated, then you might want to read something else and not read the rest, not waste your time reading the rest of it. Okay, so after abstract, there's an introduction section. The introduction section talks about previous research and the current understanding of the topic, so what scientists know right now. And then sometimes they may also identify some gaps, like what do we not know or what is missing in current understandings. And then you have a method section, which describes how the experiment was done, and it should be detailed enough that you could replicate and like copy the experiment to do it again if you wanted to. And then after that, you have the results section, which includes all the data used to reach to the conclusion, data from the experiment, or from some papers can be just like reviews of papers, reading a bunch of papers and then summarizing them. Data can be condensed into tables or figures, which are important to understand in order to understand the paper. So you'll often see data in tables or figures. There can be a lot of different kinds of figures, like, for example, like the graphs we saw yesterday. And then after results, you have a discussion section. This could also be named analysis or conclusion. And this section explains what the data means, and how the data supports the conclusion. So this is like the analyzing part. You take the data and then you like explain how you got from the data to your conclusion. Yeah, so like how you draw the results out. And then at the end, there's a reference section to include any resources that the author quoted or used. This is really helpful, and they'll often have footnotes as well. So if there's one specific part you want to check out, you can just look at it and then look at which footnote it corresponds to, and then you can read the sources that the author used. You can read them yourself. Because sometimes authors might misinterpret or misunderstand something from another source. So you can always check for yourself to make sure. Yeah, so the resources in this section can be looked at to determine if the sources are reliable and accurate. And if you want to see, and you can use the reference section if you want to see why the author referenced specific works. Okay, so now we talked about the journal structure. We're going to talk about the order that you should read a study in to make the most out of your time. Okay, so you should always start with the abstract. It tells you briefly what experiment was done and what was found. So basically, like what the researchers did and what did they find out? What was the result, the conclusion, takeaway? So you should ask yourself what specific results were mentioned and are they relevant? Are they relevant to your research topic, your research question? Is it worth looking into? Or should you just stop reading this paper and find something else because it's completely not related? And then after you read the abstract and you decide, yes, you do want to continue reading the paper, go to the discussion section. And then this section summarizes the important results and it gives the reasons behind conclusions, which are based on results. So this part is like drawing conclusions and like discussing how they got there and stuff. So you should ask yourself, do you agree with the logic of the conclusions? Do you agree with how the researchers thought and like made their conclusions? And are these results useful to you? So yeah, like once again, thinking about your own research topic, your own research question, if the results are useful to you or not. Next is the introduction section. This is right after the abstract. The introduction explains the motivation and importance of research, that specific one, and provides background information. Sorry. So you could talk about like maybe it's important because nothing similar to it has ever been done before, something like that. And you should ask yourself, do you understand the background information? Do you need to look at references for more information? And of course, if you want to look it up, you can always go to the reference section and see which footnotes are attached to it. If you want to look at more info, yeah, sometimes you have to look up some background information, some context you don't know that you need to understand it. Okay, after the introduction, you'll want to read the results. The results provides the raw data you might need for your own research. It also provides the figures and tables that show the data in a compact form for easy viewing. It's really hard if you just have a bunch of like a super long paragraph of information. So that's why people put data and information in graphs and charts. Those are much easier to see and understand. And then for this section, ask yourself, for figures, do you understand what the axes mean? So like the x and the y axes. Sometimes you would have like a cube. So you have like an x, y, and a z axes. So make sure you know what all of them stand for so you can know what you're comparing, what units are used, and does the curve make sense? Sorry, excuse me. So you have to put this. This is an example of a scientific paper, but much more simplified. So the title is Are All Apples Red by Ida Cortland. So they're trying to find out if all apples are red. So the abstract, this is the summary of it, saying we examined several apples' color. That's what the scientists did. And then it says, although most are red, some are not. So that's like the conclusions they got from the study. And both of these things are in the abstract. Next, there's the introduction. It says, an age-old question is, are all apples red? So that kind of provides a reason or like a beginning of a reason of why the scientist Ida Cortland wanted to study this question of are all apples red? Then it says Macintosh, 1993, thought so. G. Smith, 1999, begs to differ. And then it says, we hope to resolve this issue once and for all. So it presents a conflict, which is the reason why they want to study this question, because there's like opposing opinions that do not agree with each other. However, usually you would avoid using words like we, because that's like second perspective. You want to maintain the formal tone. So next section is the method section. This section, it says, we went to the local grocery store and bought one of every apple that I had. We took them home and looked at them. So this is what the scientists did with the apples. It's their experiment, their procedure. And then we have a result section. So they found after they completed what they said they would do in the method section, they found 4 red apples, 1 green apple, and 2 yellow apples. And then they made this little bar graph to showcase the results. So it's easier to look at, it's easier to understand. And then it says figure 1 because you should label your graphs so that if you have multiple graphs, you know which one you're referring to based on the name. So the name could be like figure 1. Okay, and then after that is the discussion section. It says, since we found 1 yellow apple and 2 green apples, it must be true that all apples are not red. We concur with Smith's findings. So this explains the data. They found 1 yellow apple and 2 green apples. That's the data. And then they explain the reasoning. Because there's 1 apple and 2 green apples, and of course yellow and green are not the same colors as red, it must be true that all apples are not red. Yeah, so that's the conclusion. We concur with G. Smith's findings. Yep. Okay, and then it ends with the reference section, which is like different sources you can go to if you want to learn more, or if you want to check the author's work. Okay, some other parts of the paper. I'm not sure if it's in the first part, but the methods, references, bibliography, and article information. Okay, so the method section gives details on how the experiment was set up and carried out. And this section should explain well enough that you could replicate the experiment yourself if you wanted to. So it should be detailed enough that you could copy it and do the exact same experiment as the researcher. This is often the hardest section to understand since it contains specialized techniques, like techniques for every field and topic. Skip this section until last. So it's saying that you should skip this section until it's the last one you need to do. Then it says, when reading, skim and try to pick out basic methods used. Don't worry about the other details. That's for grad school. And then it says, ask your instructor or consult a scientific encyclopedia or textbook if you don't understand the concepts of the technique. So yeah, there's definitely a lot of places to ask if you don't understand what's going on in the method section. You could ask online, ask someone in your life who's an expert, or you can also just email the authors of the papers. They'll probably understand and reply. Next section is the references and bibliography section. This provides a list of resources that is quoted or referenced by the authors. Usually there's footnotes, so like in the text itself, it'll show like a little number in the corner and say like 1 or 2 or 3, and you can it matches the number in the reference section. Let me just show you this. So yeah, so here it says like 18. You see that little 18 in the corner? That is a footnote, I believe. Maybe called something else. And then you can see at the end, it gives out a list of all the sources it used. And remember how we saw that 18 above? Well, that 18 corresponds here. So something in that sentence matches what the WHO had to say in this specific conference. Yeah. Okay. So the section, the references or bibliography, allows you to go back to those sources and see why the authors reference that. See why the authors reference that work and whether those sources seem reliable and accurate. So just because one scientist is using those sources doesn't mean it's a good source. You need to make your own judgment on whether you think it's reliable or accurate. And then it says format of bibliography. It differs between journals. So there's different formats of the bibliography. For other examples, visit Purdue Online Writing Lab, OWL. Yeah, so there might be different formats. Okay, next section. is the article information. This is a really short section. It might be in the beginning, or you might see this in like a little box if you click the cite button. But basically, combined with the author and the title information, it enables you to create a citation for the article so that you can tell other people where to find it. Remember, if you use the data or concepts from the paper, you must cite it in your reports or publications. Failure to do that is plagiarism, which could lead to failure of a course, expulsion from Purdue, and after you leave school, legal or professional consequences. So just make sure to cite your sources in MLA or something, or at the very least, collect a list of like links you use, and then later convert all of those to appropriate images and stuff. So it's always better to be safe and to cite all of your sources. So just make sure to cite all of your sources before you submit anything. And it's a good habit to keep track of all the sources you look at, you read, you use, just so you don't forget. So keep track. Okay, so here's a summary of how one should read a scientific article. 1, take your time. Don't rush through it. It can take a long time. 2, don't read the entire article at once. Start with the abstract, look at the different sections, and then only read the parts that are important to you. So first you should read the abstract, which is a brief summary, and identify what the results are and if they're relevant or not. Next, you should read the discussion and think about if you agree with the logic and reasoning and if the results are useful. And then you read the introduction, which explains why the case was written. And then you think about the and then last step is read the results that give you the data that supports the conclusion. Okay, so that's like a basic summary of how it works. And then at the end of this class, we're going to try it out. You guys are going to read a case study and then fill out this worksheet we have. We'll be doing that later. So yeah, come back. Credits versus okay. I think before we move on, we can take our second 10-minute break. So let's begin now, and then we'll come back in 10 minutes and then finish the rest of it. Okay, see you guys in 10 minutes. Okay, 10 minutes is up. Let's come back. Okay. Now we're going to talk about environmental health, which is another like topic within public health. So credit slide. We're gonna watch another short video to introduce environmental health. Let me try to search this up.
Hi, my name is Mighty Fine. I'm an expert with the American Public Health Association, and today we're going to talk about environmental health. In the early 20th century, Americans often drank dirty water, ate contaminated food, and dealt with infestations of disease-carrying animals. So it may not surprise us to learn that cholera, typhoid, and other infectious diseases, which spread when things like bacteria or viruses infect one person and pass to another, were the leading cause of death in the US back then. This was before antibiotics and widespread vaccination. So to prevent disease, the best strategy to tackle these issues was to change the environment, which we did through a number of initiatives, like creating pest control programs, building cleaner water systems, and passing food safety laws. And they worked. From 1900 to 1940, US deaths from infectious disease went down by more than 75%. This collection of initiatives grew into a branch of public health called environmental health, which focuses on the relationships between people and their environments to promote health and well-being. But as the US has changed and the leading causes of death have shifted, the goals of environmental health have broadened too. In the 21st century, environmental health monitors the natural environment, like air, water, soil, and food, and promotes health through the built environment, like the safety of our housing, transportation, roads, and parks. Environmental health is a national issue. But in practice, local governments are the ones who take action because they have the clearest picture of their community's needs and the most direct power to respond to them. That might mean inspecting a restaurant for food safety, measuring the amount of toxic pollutants in our air, or identifying areas in the community where someone might get injured. Local health officials may even consult with new homeowners and connect residents with certified contractors to make their homes safer from things like lead exposure and asthma triggers. After all, our homes are a key part of our everyday environment. But some problems are bigger in scale. So environmental health professionals need to work with other sectors to help people get the resources they need to live their healthiest lives. Like by offering government subsidies to grocery stores or restaurants with healthy and affordable food so they can operate in low-income neighborhoods. Or building well-maintained systems of sidewalks and bike lanes, which can encourage people to walk, bike, or roll. That means less local pollution from cars and a more active community. Unfortunately, people's health is often impacted by racism that's embedded in our laws and society, which drives an unequal investment in communities of color. So white neighborhoods usually end up with the most well-maintained parks, the nicest bike lanes, and the positive health outcomes associated with those resources. Meanwhile, communities of color, foreign-born communities, and low-income communities are more likely to be exposed to the environmental hazards, like unsafe levels of lead in drinking water and constant noise pollution. Together, these environmental factors can cause health disparities, which are differences in health that are rooted in unfair and unequal access to resources. In fact, a 2019 study found that our zip codes can predict certain health outcomes like obesity or mental illness better than our genes. And in cities across the nation, certain neighborhoods have life expectancies 10 to 30 years shorter than neighborhoods only a few miles away. According to APHA, to make sure everyone is living their healthiest lives, the US should strive for environmental justice, which is a movement that seeks to eliminate the disproportionate impact of environmental hazards on ethnic minorities, low-income communities, and other underserved groups. So environmental justice can look like making sure the community approves the location and safety measures for new developments, addressing active threats to health like poorly maintained landfills, and working with local residents on what they think will improve their environment. The end goal is for all people to be protected from environmental hazards and have equal access to resources which promote healthy living. So environmental health means paying attention to how all of the places we work, play, and live are affecting people's health. By monitoring health threats, building better infrastructure, and involving the community in local decisions to help ensure everyone's health and well-being. Thanks for watching. This video is part of a series created by Complexly and the American Public Health Association to shed a little light on the important work that public health does. To learn more, visit apha.org.
Okay, so some important takeaways from the video is that, well, one, environmental health is like the relationship between people and then their environment, which is like the place that they live in or spend a lot of time in. Also another impact is, takeaway is that over time, our governments, like importance that they place on environmental health has changed a lot because it used to be a really big problem, and then since then they fixed a lot of those problems, and now it's not as big of an issue. Another one is that there's a lot of inequality in environmental health. So like communities that are richer will get more like better health outcomes because they have more money and they can like use the money to build better things for their health, such as well-maintained parks. Yeah. And a lot of the impact is made, according to the video, is made by local leaders because they're the ones who are like the eyes on the ground. They can see what's going on in their communities, and then they can do actions based on what they see in their community. Because if you're too high up in government or something, then you can't really see what's going on day to day in specific communities. Okay.
Hi.
So yeah, video summary. The effects of the environment on human health. That is a part of environmental health. And then the environment can include lots of things like the air you breathe, water, buildings, transportation, etc. Environmental health can be done through policies and programs done by national and local governments. So, for example, improving infrastructure like roads to encourage biking and walking, which is really good for physical and mental health, or giving subsidies, which is money from the government, to healthy and affordable food restaurants or stores so that people in low-income neighborhoods can access them in their neighborhoods too. By giving subsidies like money to healthy and affordable food restaurants, you're incentivizing and like encouraging people to go buy there since it's affordable and it's healthy. So if you give money to those restaurants, then they're probably able to lower the prices and attract more people to eat the healthy and affordable food, which in the long run will be good for the community because people are eating healthier foods. And then unfortunately, environmental health is not always fair. Racism in our society and laws results in unequal investments in communities of color. It can cause health disparities, and then health disparities are differences in health that are rooted in unfair and unequal access to resources. And as an example, a study done in 2019 showed that zip codes predicted some health outcomes, such as obesity or mental illness, even better than our genes, which I think is quite surprising because zip codes are like just physical barriers that humans created. But seems like the inequity has been so ingrained that zip codes can predict health outcomes more than genes in some cases. Okay, so the importance of environmental health and public health. Environmental health keeps people safe from health threats that come from their environment. And a safe environment to live in is as important part of improving the health of communities as like other stuff. And then the environment can be the natural environment, like the air and the water, or parts of a man-made environment. So that could be like neighborhoods, parks, water, buildings, your house, maybe even a single room that you spend a lot of time in. So here's some examples of the air and then the sky. Here's an example of water, and then the last one is an example of a neighborhood. Okay, so let's brainstorm some possible issues in environmental health that are present in our world today. So here are some current examples of environmental health issues in our world today. We have climate change, pollutants. This could be like in the air or in the water, like everywhere, like microplastics and stuff. And other pollutants as well. Air and noise pollution. Noise pollution is like when, let's say, your house is right next to, say, a highway, then your house will have some noise pollution from the highway because like it's really loud on the highway, and then that like makes your house noisy as well. And there's also unsafe water, unsafe work environments, and then radiation. So can anyone give me some more examples on possible issues in environmental health that are present in our world today? You can type in the chat, say it out loud, whatever you want. Okay. Kevil, I see you said, would extinction count? Yes, I think that does count. If there's any risk of extinction, like if a certain species of animals suddenly goes extinct, or if we humans go extinct because of issues in the environment, that could definitely be a big issue. And then if you look at like extinction of animals, that also has a really big impact because ecosystems relies on like all the different species, and then if you're missing a species, then that'll cause a lot of problems because like all the animals like eat each other and depend on each other. So if one part is missing from like the whole web, then there's bound to be some problems. And like the wild animals are a part of our environment. It's like the outside. The impact can like vary how much it impacts you or like how immediate the impact is, because you're probably not living in the wild with the wild animals. So it might take some time for like the impact to be felt if some species were to be extinct. Okay, moving on. You can say that environmental health work is like an airport ground crew, because the goal is to make sure the population is safe. Just like an airport ground crew, their whole job is just make sure that the passengers on the plane are safe and they like take off and land without any problems. They also prevent problems, just like public health. Environmental health focuses on preventing problems, and airport ground crews also do that. Regular people do not have control over their environmental health, so they rely on professionals for their safety and health. So a lot of the environment you can't control, right? Like you can't control what type of air is in your neighborhood, or like where the water in your town comes from and how good the water is maybe. And same with airport ground crew. All the passengers inside the plane, they cannot do anything about the plane on the outside. It's all up to this crew outside. So in both of these, people rely on professionals for their health and safety. And then finally, teamwork. It's very collaborative and multidisciplinary. There's a lot of big problems. Big problems require big solutions, and then one way to solve big problems is to get a big team and have everyone work together. This is just like an airport ground crew, because all the different members have to work together in order to do one job of making sure the plane is safe to take off and land. So teamwork is very important. Okay, and then another concept is the concept of upstream versus downstream, and environment and human health. So upstream, downstream, you show this picture, it's like goes from before and then it like flows down to later. And later the impacts can still be felt. Okay, so factors upstream can affect human health downstream, because like the name suggests, it does flow in that general direction. So action needs to be done upstream to prevent problems downstream. So because the problems that happen upstream affect the problems that happen downstream, you have to, or you should, fix the problems at the root cause and then fix them upstream so that you can prevent problems from happening downstream. All right, so let's talk about each type of stream. So upstream is like environmental factors. So that's like decisions, policies made on a large scale in an earlier time frame. Or downstream, that's like individual people's behaviors and consequently health, people's health, maybe issues or something. This is at a later time or results. Because it's downstream, it comes after the upstream, after it has flowed through upstream, it goes to downstream. And then also related to health disparities, people being treated unfairly in health. So yeah, environmental health is definitely related to health disparities. Yeah, and here's the upstream versus downstream. Like drawing, because it might be easier to understand. So upstream factors is like physical environment, the physical space around you, the economy and work environment related to jobs and online, social environment, which is online environment and social hierarchies, and then service environment, which is like the services that people use. And then all this can go downstream to individuals' behaviors, how they act, how they behave, diseases and injury, how they get hurt, where they get hurt, and then morality, which is if they die or not. Okay, here are the sources for that section. And then now we have about 40 minutes left. So we're going to do that paper reading activity from 4. But before we do that, does anyone have any questions at all? No, okay. We'll go back and do the paper activity. Okay, so I'm gonna put the article in the chat, and then I'm also gonna put this worksheet in the chat. I'll give you like, I'll give you 15 minutes to try the worksheet by yourself and read the study, and then afterwards I will do the worksheet so that everyone can see how I do it. So the first link is the article, and then the second one is the worksheet you're going to use to practice. If you can't access this, let me know. It should force you to make a copy. Yeah, so I'll give you like 15 minutes, and then after 15 minutes, we can go over it. Yeah, so you guys can work on that. I'll set a timer on the screen so you guys know how much time you've left. Oh, did you have a question, Eli, or you're just searching? Oh, it says access denied. Is that the first one or the second one? Like the article or? Okay, second one. Let's see. Let's stop sharing. Are you able to make a copy of it? Okay. Okay, I made a copy of it and then I'll put the link in and then can you guys make your own copies? Like go to file and then make a copy. Okay, give me a second. Let me do this. Okay, can you guys try this new link? Tell me if it works or not. Works. Okay. You guys don't have access to the second one either? Um, but try this one. Can you guys access that one? Okay, great. Um, okay, here's a 15-minute timer. You guys have 15 minutes to work on the worksheet. If you're done early, just like say something. Yeah. I'll be back in 15 minutes and then we can go over it. yeah, so we're just like thinking of um thinking of things of like anything you can think of. Anything that comes to mind. Yeah. Okay, I'm gonna do the worksheet so you guys can see it. Okay, it is 5 o'clock, so you guys are free to leave. I will finish it up and then I'll make sure the link is posted. Yeah. Okay, that's it. Bye everyone.